Alannah, thanks so much for joining me on the Journal Club this week.
No, thank you for having me.
Now, we're going to discuss a paper that you published, and it's only been recently published this year, I think it is, where you've put together a new framework for the classification of athletes. First of all, congratulations on another publication.
Thank you. Yeah.
Yeah. So give us some background, like with as a physio, I've spoken. We talk all the time about how we classify athletes, whether they're elite or they're well trained or they're recreational or level one or level two. So you and your team have put together a little bit of more structure around this. So tell us the background. Why did you decide to do that?
Yeah, so this project really came out of some of the work two of our PhD students were doing, Ella Smith and Megan Kirkman, and they're really looking at going through all the literature in sports medicine and sports science and understanding the female representation that's occurred. And when we were looking within that female representation, we wanted to know whether the females were elite or sedentary or somewhere in the middle, really. And we just really couldn't find a tool that we could use to classify these athletes across all sports and all scales of ability. And we just realized that there's so many different terms used throughout the literature, whether it's well-trained or elite or highly trained, or it was really difficult to understand what those terms really meant. So based on that work that was going on the side, we decided to come up with a framework that they could use essentially to classify their athletes, but realized that this project was actually much bigger and could have much wider implementation for all practitioners. And myself and Louise Burke and Trent Stellingworth, Ella Smith, Indigo Majuka, David Martin, Vicky Tolfrey and Jeremy Shepherd all got together, and every one of those people have a different speciality, whether it's endurance sports or middle distance sports, skill-based sports or Paralympic sports. And we came together and put this framework together that can be used really to classify athletes' training ability across all abilities and all sports.
Does it matter? I mean, is it just semantics, or does it actually make a difference to clinical practice and research?
I think it does make a difference. I think we use the example of beetroot juice as an example in the paper, where the literature shows that it actually is probably effective for a tier 3 and below, so recreational athletes. But once you get closer to the ceiling of performance, being that elite level, we don't see as many performance benefits. And if our cohorts are mixed and we don't know in terms of ability, or we're not defining what cohort we're using, I think we can be misinterpreting the literature and the research that's been done.
I agree. I mean, I read some papers sometimes on cycling, for instance, and they'll talk about that they do a study on extremely elite cyclists, and then you have to say, can we extrapolate those results and data to your recreational, and then vice versa as well. So I think that kind of having the research, particularly done in tiers, means that we can then kind of apply those research findings to the tiers of the actual population on the ground.
Yeah, and I think it's not that we need to exclusively look at tiers each time, but it's more just when we are doing research, having a systematic way that we can know what cohorts we're looking at within each paper, or if it is a mixed cohort. I think that's really important for the reasons you just said. Yeah.
Tiers that are in that you put in your paper, starting with tier 0, going up to tier 5. So 0 is sedentary, and then tier 5 is world class. So let's go through them one by one really quickly. So if you're a tier 0 and you're sedentary, like what are you? What kind of athlete? One thing I always say to my patients is everyone's an athlete, but just at different levels. So yeah.
Yeah. So we really, I guess one of the aims of the paper was that everybody has a place. So you don't have to be, if any paper you're looking at and you're going to define the participant cohort, every single person has a place no matter their abilities. So tier 0, our sedentary population, is those that don't meet the recommended World Organization guidelines for physical activity, so less than 150 minutes per week. So they would be defined as sedentary according to those guidelines. And then alternatively, we move into tier 1, where it is those people that are meeting minimum exercise guidelines of those 150 minutes per week, but they may not be training in any particular sport or for any particular reason. They're just physically active people.
And I think that the two most interesting things about this, and you do this nicely in the paper where you put the percentage of the global population and also the Australian population there, 46% of the global population are in tier 0, and then 35 to 42 of the global population are in that recreational active group as well. So the vast majority of people are in 0 and 1.
Yeah, and that was really important to us as well when we were coming up with this tiering, is that it really met the population statistics. Because I think what we do read in sports science literature, as we said before, the amount of papers that read elite athlete, but really when we're talking about an elite athlete, it's the tiniest percentage. So when we went back and put some figures for some of these numbers, we did it for Australian population just so we had something that was a bit more inclusive, because the data for different parts of the world, when we try to mesh it together, can be a bit subjective. So we did both, and they lined up fairly well. But yeah, the majority of the population really is sedentary, which is another issue in itself. But tier 1 of those people that are meeting exercise guidelines, most of them you wouldn't define as an athlete. Yeah.
No. All right. So then we've got tier 2, which is trained and developmental, and tier 3 is highly trained and national level. So do you want to talk to that?
Yeah, so I guess the differentiation now with tier 2 is that individual is training specifically for the sport that they're being classified against. So if you are playing soccer 3 times a week, that is the sport, and therefore you would become a tier 2. There's no performance standard. It's more an intention to train, and there's also a regular training interval of about 3 times per week. Tier 3, on the other hand, is where our first performance standard kicks in. So this, you need to be near the maximal training load for that sport, and you're likely competing at the national level. So there is a performance standard that comes along with that tier 3 classification.
And I suppose, again, looking at those statistics, I mean, it's only I started with the global population data. I'll keep going with it. So tier 3, highly trained national level athletes, is only 0.014% of the population.
Yeah, tiny amount of the population. And we actually, again, these numbers are really sort of our best fit at what we could put together about the data we could find. But also when we looked against many sports, we found this was about 20% of a world leading time. So if you think of the best marathon performance being around the 2-hour mark, and 20% of that time, you really are looking at a smaller amount of the population that can run in that sort of bracket.
Okay. Then we move right up to the top of the tree, tier 4 and tier 5. Tier 4 is elite or international level, and then tier 5 is world class. So it's pretty rare territory. But I'm interested in the differentiation between the elite / international and also the world class athlete. So, for instance, like in your criteria, that a world class athlete is like an Olympic medalist or a world champion, or I think they're in the top 3 to 20, of their sport. Whereas an elite or an international level person is someone who's, let's say, competing in international teams. So I'm interested in why you actually distinguish those two tiers, and why they weren't essentially combined into one.
Yeah, I think when we were looking at it, we were really thought that when we look at those tier 5 athletes, those world-class athletes, those athletes that can perform to within 2% of the world leading time, although they are the best in the world, they may have world records, they're almost a special type of individual compared to somebody in a tier 4 where they could be the 300th best person in the world. And particularly when we're looking at small differences in, say, physiology or skill in some instances, we wanted an ability to differentiate those two. I would say a lot of research would put those two together. It would be a tier 4/5 research. But I think what we wanted to be able to say was that if a research paper is done, there's a great one Andy Jones has done about marathon running with the Nike project, where he had a cohort of about 15 tier 5 athletes. That's exceptional, and research doesn't really ever target those top 20 people in the world. And usually they are case studies. And I think having that tier 5 differentiation allows those studies to gain more traction because of the special, unique type of individuals that they're being studied. Whereas tier 4, it's still as good as it gets. We're talking Olympic level athletes, but differentiating 300th place at the Olympics compared to first place at the Olympics, it could be, it's the difference between medals. So why shouldn't we look at it in terms of research and classification in the same way?
That's a great answer. Some of the classifications of those tier 5 athletes are pretty clear. Like you look at someone like Ash Barty, you say definitely world class. Michaela Schifrin, definitely world class. Anyone who's won Olympic gold, world class. But then there's some people then and athletes who I thought, where would I put them? And I wrote them down, and I thought I'd ask you the same as well. And just the good talking points. So one is NBA star LeBron James. So LeBron, has been touted as the best basketballer for a long time. So where would you put him? What tier would LeBron be?
Yeah, and you picked up a really great point about the classification framework, in that we put it together, but we really left it open for interpretation for the person using it. It's very flexible, and it allows that sort of subjective call to be made. And we've discussed some of these points in the paper, and one of them is that we try to keep classification to within a 4-year cycle. So if you're using the performance outcome of that individual, we try to keep it within a 4-year Olympic cycle, or within a time frame that's relevant to the sport. So LeBron, I would probably put still as a tier 4 athlete. He's no longer that world-class MVP athlete that we once had, but he is still playing in the NBA, from what I know, and therefore he would still be classified according to our framework in that tier 4 level. But say 5 years ago, if we were to classify him, there's no doubt that he would be up in that tier 5.
Okay. Then another one that sprang to mind is this man called Nimel Purja. So there's a Netflix series about him at the moment where he's done this extraordinary feat where he did 14 peaks over 8,000 metres in just over 6 months, which I think, in inverted commas, is a world record. But he's not really competing at the Olympic Games. He's not playing in the NBA, for instance. He's clearly an elite athlete in the old terminology. But again, under your system, can he fit in? Can we put someone like that in this criteria somewhere?
Yeah, I think again, this is sort of where the practitioner using the framework needs to make the call. So if you are looking at defining a cohort of, peaking mountain climbers, he would have obviously go straight to tier 5. If we're looking at that as the sport that's been classified, he would sit in tier 5. However, if he was in a study that was looking at runners, for instance, he may be able to run, but because he's not meeting that tier 2 criteria of training 3 times per week in running, he wouldn't make that grade. He'd be a tier 1 because he's meeting physical activity guidelines, but they're not specific to the sport that's being classified. So I would say if whoever was doing this study, if they're classifying mountain climbers, he's a tier 5 without a doubt. If they're classifying something else where he may be a part of, he'd probably fit down in tier 2 because he's not training specifically for that sport.
The other one that sprung to mind is that I'm a swimmer, and occasionally at my pool, an underwater rugby team turns up to train in the diving pool. So I looked it up, and I found out that there is a World Championships of underwater rugby, and in 2019 the Colombian team won the World Championships of underwater rugby. So I was thinking about the captain of that team. Clearly, the captain of the Colombian underwater rugby team would be the top of his tree. But if I look at the calibre of athletes that are training down at my local pool, who some of them are in the Australian team, I think some of them would beat me at the pub. There's no doubt about that, with all due respect, but that's about it. So I just wonder, with these obscure sports, with things that are just a little bit outside the mainstream, I mean, did you guys give some consideration to the classification of those people as well? So, for instance, that the captain of the Colombian team, I suppose, would be world class, tier 5, but maybe not.
Yeah, I think we had a little bit of a discussion more around more conventional sports, but sports that have greater participation rates than others. So think of the depth of field within the sport, if I can put it that way. So again, if we think of track and field in America, it's so densely populated and a sport that many people could be at, a tier 4 level, but never get to go to the Olympics because they're so good. And then you can think of some of these more obscure sports, still Olympic sports, but maybe skateboarding and surfing, the newer sports that don't have the same depth of field. And when we look at, say, tier 4 in the elite cohort for track and field, we think the top 300 Whereas in our paper, we talked about, say, something like snowboarding, where it actually be tier 4 would actually only be the top 30. And I think when we start to talk about these obscure sports, that consideration comes in again, where, you know, it might no longer be the top 30, it might even be the top 15 or the top 10, because we have to think of the population statistics and the spread of that across the tiers. And if, you know, again, it's specific to the sport. So if we're classifying underwater, what was it? Underwater water polo, underwater hockey,
Underwater rugby.
Underwater rugby.
Yeah, you need to look. You need to YouTube it. You'll get. It's very entertaining.
Yeah, I think if we're classifying that cohort alone, you know, these guys will at least fit that tier 2 recommendation of training to, you know, certain times a week for the sport. But that doesn't mean just because they're on the Australian team may no longer fit that population statistics type spread, and the depth of the field would have to come in as a consideration.
And Alannah, where do the disabled, the junior, and also the masters athletes fit into this paradigm?
Yeah, and this is a really great question, because we knew that they need to fit into the paradigm because we have really high level athletes in both masters, juniors, and Paralympic sports. But we're really still unsure of how they blend in, or whether they need their own separate paradigms, I think is what